sir. Thank you, sir. Respected judges, now I am going to speak on stabilization of refraction in SICS. Delay in spectacle prescription following cataract surgery leads to a decrease in quality of life and productivity in post-operative period. SICS is often discredited for late visual rehabilitation in comparison to phacoemulsification. So spectacle prescription still is recommended after 6 weeks post-op. So there are few studies to refute this. So the objective of our study is to determine the time required to achieve refractive stability following SICS by comparing the subjective refraction at 2 weeks and 6 weeks post-op, and to recommend changes. So method, after obtaining institutional ethics committee approval and written concept, 200 adults were selected who had uncomplicated manual SICS, and PMMA IOL was implanted. As 6 opted out, ultimately 194 cases were there. We exclude patients with history of glaucoma, any other pathology, traumatic cataract, and complicated cataracts. So statistical analysis was done by SPSS version 2. Descriptive analysis, categorical data were expressed as number percentage, continuous data as mean and standard deviation. Continuous variables were subjected to SAPIO-weak test and found significantly different from normal distribution. So we used for comparison Wilcoxon sign drag test for unpaired data. So this is the demographic profile of the cases. Majority were more than 50 years of age. There are 103 males and 91 females. 93 right eye and left eye 101. So change in refraction was, no change in refraction was observed in 161 eyes, that is 83%. Change in refraction was considered as either no change or less than 0.5 diopter. Change in cylindrical in 19 cases, change in spherical in 9 cases, change in both spherical and cylindrical in 5 cases. So the majority of the patients had no significant change in refraction at 2 weeks and 6 weeks post-op. So these are the statistical value where there is no significant difference. So as there are not much of studies, we didn't have to, our conclusion says post-op refraction was stable from 2 weeks post-op. So our study conclusively proves spectacle prescription can be given to patients after 2 weeks following an uncomplicated SICS in the absence of any ocular pathology. So the prescription guidelines can safely be revised. The limitation of our study was it included only eyes with good visual potential and a good initial visual outcome. So refraction at both visits were not conducted by the same refractionist in every case. Hence, the degree of measurement bias cannot be ruled out. With this limitation still, we can recommend spectacle prescription after 2 weeks post-op in case of SICS. Thank you, sir. Thank you very much.
Dr. Pattanayak wants to convey that the visual rehabilitation can be done after 2 weeks.
Yes, sir.
Usually we are doing it after 1 month, 4 to 6 weeks.
1 month or 6 weeks, that is still the conventional in SICS mostly.
So he's doing SICS, he's a veteran in SICS, and he's trying to make SICS a refractive surgery also.
Still it is comparable in every aspect. Thank you, sir. Thank you, sir.
So it's about early visual rehabilitation, but sir, there are 6 surgeons, and all were having a different techniques definitely, and all have the influences on the incisions. And do you definitely you have averaged everything? So do you recommend the protocol to provide spectacles for the latter life for each and every surgeon, for each and every patient?
No, that is not possible because it all depends upon your confidence level and expertise in doing the surgery, how confidently you can do. But my point is it is possible. Suppose this is not a contraindication or not a something very different from phacoemulsification where stabilization takes time, something there. That's correct. Given, yes, yes. And mostly that from that only I got this point of in many cases that didn't change. So that's why I thought why not to do a study on the change in refraction and then compare it. Thank you, sir.
One practical question. In fast-going life, everybody wants to see clearly. within
As
days.
quickly as possible.
How you convince them?
No, people are convinced. It all depends upon the confidence.
They want to see closure nearly, distance
Closure
nearly,
we
sir.
see in SICS, the
And they will-
advantage,
and they will compare you, they got operated there in
multifocal.
there,
No,
so
the
how
advantage,
you
advantage with SICS is mostly there is 0.5 to 0.75 or 1.5 minus against the rule astigmatism. Usually that occurs in SICS.
that your percentage you're not going to understand.
No,
what
no,
you
that,
are-
that you have to
that you
convince
have
him
to
ultimately, because it all depends upon his confidence on the surgeon whom he has decided to